So I made it just in time. I'm just kidding, I'm a little bit late. So first of all, shout out to the bartender because they laced it. All right, y'all. Y'all know it's Thursday. Thursdizzle. What? How y'all doing today? It is Thursday, so it is NCLEX Jeopardy time. Our NCLEX review for RN and PN. Let me bring up my. When I say I made it here just in time, I was at dinner or lunch or whatever you want to call it, and I was like, oh my god, it's time for me to go home because I have to do live for NCLEX Jeopardy. Like, what's happening? And so I raced over. Okay. I raced over and I was like, oh my god, just in time. There was one parking spot left. Otherwise, I would have still been walking home. How y'all doing? Hey. How are your weeks going so far? How's your day going so far? Oh no, what's that? No. Okay, hold on one second. Oh my gosh, it's so annoying. Hold on one second. Okay, y'all know how this is like my fourth AirPod. I lost one all over again. Okay. I just want to make sure y'all can hear me. Can y'all hear me? Because I had to just take out my earpod, whatever it was called, and then switch it back over. So I just want to make sure y'all can hear me. Give me a thumbs up if y'all can hear me real quick, real cute. Okay? Someone said, so I took my TEAS test today and passed reading management, not the English. That's okay. That's okay. At least you passed something. Congratulations, Victoria. Yay. Did you get the overall score that you wanted to, though? Okay, cool. Y'all can still hear me. Perfect. All right, so let's go ahead and pull up our NCLEX Jeopardy for this week. All right, so NCLEX Jeopardy, just in case it's your first time, second, whatever, you're new to the squad. NCLEX Jeopardy is our weekly group study session. Okay, it's 100% free. But that's basically my way of making sure you guys are getting the material that you need, comprehending whatever material that you need for whether it's for NCLEX RN, NCLEX PN, or like a chapter test, a semester, within your semester. I'm not sure. But so I wanted to incorporate NCLEX Jeopardy into your weekly routine so you can get used to taking your taking your practice questions, because practice makes perfect. And then also making sure that you guys are really comprehending the material as well. So that's why we go over it as a group. It's real fun. We play for prizes. It's really fun. All right. So if it's your first time, please let me know it's your first time. Comment it down below that it's your first time or it's your first timer. Hold on. Let me see what y'all saying. I'm just working full-time student to study for the NCLEX. All right, I'm gonna let y'all answer that one. Okay, great. So, real quick, I just posted something on my feed. It was the therapeutic drug levels. Okay, so you're definitely going to need, if you don't have that saved, or if you don't have those specific therapeutic drug levels ingrained into your mind, go ahead and save that post, look over it, because you're definitely going to need it at some point in your nursing school career. Okay, so hello all my first timers, welcome. All right, so it's called NCLEX Jeopardy because it's actually like Jeopardy style and it makes it fun. So y'all know me, I love to have fun, especially doing my reviews. It really helps the person to grasp whatever concept if they haven't grasped it before. And it also helps them with being able to retain and recall. Okay, so every week, every Thursday, all right, we do these free NCLEX Jeopardy reviews. We go through about 5 to 10 questions as a group, and then the rest of the 25 questions is going to be uploaded into the app. The app is called the nursesam.com. The NurseSam app. You can get that for free, whether it's your Android phone, Apple Store, App Store, or your iOS App Store for your Apple. Either way, it's 100% free. Just go ahead and download the app. Once again, it's called the NurseSam. And once you do, when you go to NCLEX Prep within the app, you'll see the widget for NCLEX Jeopardy, like the mobile version, and you'll be able to play all 25 questions. So during live, we play about 5 to 10, but on the app, the free app, you can get access to all 25 questions, whether it's, after we go over live, randomly, maybe you're on the bus, maybe you're on like a work break. It's anytime, anywhere studying, which is why I love it so much. So with that being said, this week's categories, all right, we have pharmacology, pediatrics, mental health, fundamentals, and adult health. Those are our 5 categories. This is 10. Those are 5 categories for this week. All the questions and all the categories range from 100 points all the way to 500 points. So with that being said, we are obviously playing for points. All right, the winner with the most points will win an Ultimate Nursing School bundle or whatever bundle of your choosing. Okay, so how this works, I'm going to read the question. I'm going to read the answer choices. You guys are going to respond back, and because this is Jeopardy, you guys are going to respond back in true Jeopardy style. So you have to say like what is, and then whatever the answer is. So if it's like, it's multiple choice, so 1, 2, 3, or 4. So if the answer is like 2, you have to say what is 2. Obviously, it's Jeopardy style. Okay. In order for you to be correct and considered for the points. All right. So I'm always say this. All right. There's 2 things that I always want to say. I want to get through your minds. Okay. The first one is that just in case there's some kind of lag, I can only go by what's on my screen. Okay. So just in case, you have the internet of all internets. I don't, apparently, clearly. I'm going to go by what's on my screen. So just in case maybe there's a lag or something like that between your screen and my screen, and you have another person, or maybe you're first as far as answering, I can't see that. I'm going to only go by what's on my screen. Okay? And then the second thing is... Wait, hold on. Sorry. I just went the thing. Yeah, the second thing is... I honestly don't remember what the second thing was. So, my bad. If I remember it, I'm going to just go ahead and just say what it was. But for right now, I do not remember. Like I said, I'm going to read the question, the answer choices. Oh, this is the second thing. Just in case you don't answer first, just as long as you answer correct, that's the whole point of this thing. Okay, we do it in a group setting, in a Jeopardy style setting, just to make it more fun. But other than that, as long as you're answering the question correct, then you're really on your way to making sure that you pass and annihilate this NCLEX, period. Whether it's RN or PN, you're going to kill it, okay? But that's why we do these weekly practices, to make sure you guys have that confidence and have that the knowledge behind that to back it up. Does that make sense? Let me look what y'all saying. All right, so I'm going to go ahead and read the first question with the answer choices, and I'm going to get y'all to go ahead and start answering. All right, so y'all tell me what's the first category, okay? Our categories, once again, we have pharmacology, pediatrics, and mental health, fundamentals, and adult health / med-surg. So what's going to be our first topic of the evening? What's going to be our first topic of the evening? Okay. What is our first topic? Mental health. All right, the first thing I saw was mental health. So let's go to mental health. Let's do mental health for 200. Let's do mental health for 200. Okay. All right, so I'm gonna, like I said, I'm gonna read the question. I'm gonna read the answer choices, and y'all have to answer in true Jeopardy style. So you have to say what is, and then 1, 2, 3, or 4. Okay. All right. So first question: mental health for 200. A depressed client on an inpatient unit says to the nurse, "My family would be better off without me." Which is the nurse's best response? 1, have you talked to your family about this? 2, everyone feels this way when they are depressed. 3, you will feel better once your medication begins to work. Or 4, you sound very upset. Are you thinking of hurting yourself? Which is the nurse's best response? Okay? I'm gonna read it one more time. A depressed client on an inpatient unit says to the nurse, "My family would be better off without me." Which is the nurse's, aka y'all, what is the nurse's best response? 1, have you talked to your family about this? 2, everyone feels this way when they're depressed. 3, you will feel better once your medication begins to work. Or 4, you sound very upset. Are you thinking of hurting yourself? What is our answer? Don't forget to say what is. Hey, Morgan. Hey, boo. Hey, boo. How y'all doing? All right, so, I just have a healthy mix between what is 1 and what is 4. So let's see what our real answer is. Y'all know that y'all get like a typical amount of time, as far as typical amount of time per question. Y'all get about 60 seconds, so a minute per question. So let's go ahead and see what the correct answer is. Because I see, like I said, I see like a half and a healthy mix between what is 1 and what is 4. So let's see what the answer is. The answer is, drumroll please, what is 4? That was fucked up. What is 4? You sound very upset. Are you thinking of hurting yourself? That is the correct answer. You sound very upset. Are you thinking of hurting yourself? All right. Rationale says this. Clients who are depressed may be at risk for suicide. It is critical for the nurse to assess suicidal ideation and plan. That's super, super important. Not only are you going to have your eyebrow raised for just in case they, thinking suicidal thoughts or anything like that, you want to also make sure or eliminate the fact that they have a plan. Because it's one thing to be like, oh my gosh, I'm so depressed, I'm just going to end it all. But it's a whole nother thing to say that, but then also have a plan of how you're going to carry that out. All right. So as the nurse, you want to assess A, suicidal ideation, and then B, you have to assess whether or not they have a plan to take out said suicidal ideation. Okay. It says the nurse should ask the client directly whether a plan for self-harm exists. Options 1, 2, and 3 do not directly deal with the client's feelings. All right. Remember, 1 was, have you talked to your family about this? No, that's not the answer. 2 was, everyone feels this way when they're depressed. No. And then 3 says, you will feel better once your medication begins to work. That's also no. And then even further, they didn't let us know that they let us know that this patient was depressed, but they did not let us know that they were on medication. So you don't want to assume and let them know that, or automatically think that they're on medication when they may not be. Okay. Talk therapy is a thing, and you don't always have to have pharmacological therapy as when you're depressed. Okay, so the answer once again is 4. You sound very upset. Are you thinking of hurting yourself? Okay, that's the answer. First person to say what is 4 on my screen is, one second. Let me look. Let me scroll all the way back up. First person to say what is 4 is everything Ari XO. I lost my pen. I can find it again. Everything Ari. Hey boo hey. XO, right? Yeah. Everything Ari XO. Awesome job. So you're on the scoreboard with 200 points. Yay! All right. So all my other loves that got the answer correct, even though you were not first, like I said, we're playing for points just because it makes it fun and there's a fun incentive. But if this was the NCLEX, as long as you answer the question correct within the allotted time frame, you're good. You're golden. Okay. So all my loves had said what is for, even though they weren't first. All right. Everything Ari was first. Who else said what is for? Slayed by Shay, Cupcake Love, Nicole 2K3. XK, Sandra Akoma, Healthy Hair Goals, Naya Nichelle, Kyandra Smith, Loki Brat, Rhea Harkins, Morgan San Diego, One Love Jones, Cornesia, Lovable Lashia, Queen X CX06. Yes, Morgan said gotta be 4 because it is about safety. Absolutely. Now, Morgan, that's a cheat because you know you are a mental health nurse practitioner, so you know all these answers. You can only ask one thing, and the priority is always safety. Oh, you better give us the tips, ma'am. All right, so awesome job. Somebody said what is for, who even said what a 4 was. She must have got the buck. How do we see the questions? Yeah, but y'all, she a little lit. I know, y'all don't do that to me. Patty BK, you snitching, and we don't like snitches. It is like using for the questions. Absolutely. I said what D is. I don't follow directions. All right, so once again, next question. Let's go ahead and go to the next question because y'all already got that after y'all call me out. Yes, I'm just coming from dinner. I am a little bit lit, but that's fine. Okay. So we just did mental health for 200. All y'all was saying pharmacology. So let's go ahead and go into pharmacology, child. Ooh, ew. Okay, so this one is pharmacology for 400 points. Alrighty. So, an outbreak of head lice infestation has occurred at a local school. The school nurse is providing instructions to the mothers of the children attending the school regarding the application of malathion. Okay? The nurse should tell the mothers to take which action? 1. Apply the lotion immediately after after washing the hair. 2. Pour the lotion onto the hair and then rinse immediately. 3. Allow the lotion to remain on the hair for 10 minutes. This is for 10 minutes and then rinse with water. Or 4. Leave the lotion on for 8 to 12 hours and then wash the hair with non-medicated shampoo. What is our answer? All right, I'm going to repeat that one more again. We have an outbreak of head lice infestation, all right, at our local school. Yikes. The school nurse is providing instructions to the mothers of the children attending the school regarding the application of malathion. The nurse should tell the mothers to take which action? 1. Apply the lotion immediately after washing the hair. 2. Pour the lotion onto the hair and then rinse immediately. 3. Allow the lotion to remain on the hair for 10 minutes and then rinse with water. Or 4. Leave the lotion on for 8 to 12 hours and then wash the hair with non-medicated shampoo. What is our answer? What is our answer? All right, I'm going to scroll all the way up. To see whoever answered first. If y'all talk about me being lit, I'm gonna block you. I'm just kidding. I'm totally just kidding. All right, so a lot of people saying what is 3. A lot of people saying what is 3. We have some people saying what is 4. I'm about to yawn. Oh my God, I'm so sorry. My bad. Vodka. All right, so the answer is, what is 4? What is 4? Leave the lotion on for 8 to 12 hours and then wash the hair with a non-medicated shampoo. That's the answer. All right, it says the instructions for the use of malathion are as follows. Just in case you didn't know what malathion was or the instructions, you better take note. You better take note. All right, it says sprinkle lotion on dry hair and then rub gently until the scalp is moistened. Oh, I hate that word, moistened. Allow to dry naturally. All right, after 8 to 12 hours, wash the hair with a non-medicated shampoo. Rinse and use a, hold on, sorry. My bad. Wait, 1 second. Rinse and use a fine-tooth comb to remove lice. Ooh. And repeat in 7 to 9 days if needed. All right, that is how you use malathion, which is for head lice infestation. All right, the correct answer was 4. Leave the lotion on for 8 to 12 hours and then wash the hair with a non-medicated shampoo. That is the correct answer. First person on my screen to get it correct was, 1 second. I think it was IBBug602. IBBug602. Hold on, I just want to scroll back. Wait, no, I lied. Sorry, it was A1 Shebe. A1 Shebe. Where you at? There you go, boo. You were actually the first person. So A1 Shebe. A1 _ Shay. Bay. I was like, how do you spell Bay? With a Y or E? All right, so A1 Shay, you are on the scoreboard with 400 points. Congratulations, and you are currently in the lead. Right behind you is Everything Ari with 200 points. But we still have like 30 minutes to go. It can be anybody's game, so don't get discouraged. Like I said, we're playing for prizes, but the real comprehension and the knowledge is really the prize. Okay? All right, so great job. We did mental health and we did pharmacology. Let's go ahead and do fundies. Let's do fundies. Ooh, fundies for 300. Fundies for 300. Wait, first, let me call everybody that got 4 for the last one. A1 Shebe was the first person, and then IBBug602, Ms. Wright, P. Wiley. Awesome job, everybody. Great job. Hey, the boot nurse. How you doing? All right, so fundamentals for 300, okay? We are learning pretty much whatever you want to learn. All right, this is NCLEX Jeopardy. So we're answering questions and whatever you need to learn and catch up on, that's what we're doing pretty much. This category is fundamentals, and it's fundamentals for 300. So it says, a client with a diagnosis of hyperphosphatemia. Hyperphosphatemia. Break it down and just tell me what it means. All right, so a client with a diagnosis of hyperphosphatemia has been treated with dietary management and phosphate binding gels. The client reports to the clinic and the nurse is reviewing the lab results. Which reported serum phosphate level would indicate improvement in the client's condition? 1, 4.0, 2, 5.2, 3, 6.0, or 4, 6.5. Which reported serum phosphate level would indicate improvement in the client's condition? Remember, they have hyperphosphatemia. All right, so which reported serum phosphate level would indicate improvement of said condition? All right, is it 1, 4.0, 2, 5.2, 3, 6.0, or 4, 6.5? What is our answer? What's our answer? Sir, what's our it? Sir, what's our it? Sir, what's our it? Sir. All right, let's look. The answer is, what is 1? What is 1 4.0? Okay, so if you said what is 1 or what is 4, do you mean 4 point? No, never mind. I'm not even going to complicate it. I'm not even going to complicate it like that. But what is 1 is the correct answer. Or you should have said what is 4.0. That would have made it easier. All right. So it says the normal range. First of all, y'all tell me, what's the normal range of serum phosphate? Tell me right now in the comments. Tell me right now in the comments. Don't laugh at me. I'm lit. I'm lit. Period. All right. What is the normal range of serum phosphate? Tell me right now in the comments. Okay, Sandra. 3.0 to 4.5. It's not 3. Somebody said like, hold on, wait, 3.5 to 5. That's potassium. 3.5 to 5 is potassium. All right, but phosphate. I know it's 2 different P's. Potassium, phosphate. Let's go phosphate. All right, but phosphate is 3.0 to 4.5. Okay. 3.0 to 4.5 milligrams per deciliter. 3.0. Okay, good. 3 to 4.5. Hold on, buddy, y'all. Oh, God. I can't. I cannot keep up with you young kids anymore. All right, so the normal range of serum phosphate is 3.0 to 4.5. All right, the only option that indicates remember, it's asking us for the level that indicates improvement in the client's condition. All right, so remember the diagnosis was hyperphosphatemia. So would you expect if someone has a diagnosis of hyperphosphatemia, would you expect for that phosphate level to be higher than normal or lower than normal? Let me know. Would you expect for the phosphate in a patient with hyperphosphatemia, would you expect for that to be higher than the normal range or lower than the normal range? Higher. Thank you so much. Absolutely. Let the words help you. Hyper. Wait, what's going on right here? Hyper. All right, that means above. Hyperphosphatemia. And then the emia just means in the blood. All right, so hyper, more than the normal range, all right, of phosphate within the blood. So if the normal level is 3.0 to 4.5, then you would expect for their phosphate level to be way above, let me not say way above, but you expect for their phosphate level to be above 4.5, since that's the range, 3 to 4.5. All right, so you can expect for it to be 5, 6, 7, 8, 9, 10, 11. You expect for it to be all that because those are hyper above the normal range. All right, so the question is asking us which level would indicate improvement in this condition. All right, so if we have a patient that has hyperphosphatemia, what would indicate that the medication is working and the client's condition is improving? That phosphate level being brought back down within the normal range. That would indicate improvement. Okay, so if the range is 3 to 4.5, then we're going to look for an option that's between 3 and 4.5, and that's why the answer is what is 1, 4.0. All right, because once again, 3 to 4.5 is the normal range, and if we have hyperphosphatemia, then we can expect for it to be greater than 4.5. But if we're looking to see which would indicate improvement, aka going back to the normal range, then we would expect to see a level between 3 and 4.5, which is why 4.0 is the answer. Does that make sense? Okay, great. Yep, we pretty much got that one. Who got that first? Who said what is 1 or what is 4.0 first? 1 second. Wait for it. I'm scrolling on the river. I didn't have anything creative to say. What is one? Who's the first person to say what is one? Hey, Benta Kib. All right, Benta Kib was the first person to say what is one. So Benta Kib is on the scoreboard. Hey, boo, hey. Congratulations. That was for 300 points. So you are now on the scoreboard with 300 points. Awesome job. Who else said what is one? NC Pink Rose. Cupcake Love. Oh, I want a cupcake. Shawnara. Kiss My Asteroid. Cute name. Everything Ari. She's My World. Low-Key Brat. Miss Fig. Are you saying 4? Number 4 or 4.0? I'm not sure, but I'm going to just give it to you anyway. Woman of... Wait. I don't think so. I don't think... Not you. P. Wiley. I'm so sorry. All right, P. Wiley got it. Awesome job. She's My World. C. Monet. Beautiful Me. Candy So Sweet. Just a Tiny Tinker. Awesome job. So great job to everyone that got that. All right, let's go ahead and move on. Yep, I put the questions down. All right, let's go ahead and move on to the next question. We did mental health. We've done pharmacology. We've done fundamentals. Let's go ahead and do, okay, pediatrics or mental health. Pediatrics or med-surg. Med-surg, let's do it. Let's do, oh, let's do this one. This one's med-surg / adult health for 500. Okay. The nurse is caring for a client with Addison's disease. Okay. The client asked the nurse about the risk associated with this disease, specifically about Addisonian crisis. Regarding prevention of this complication, how should the nurse inform the client? 1. You can take either hydrocortisone or fludrocortisone for replacement. 2. You need to take your fludrocortisone 3 times a day to prevent a crisis. 3. You need to increase salt in your diet, particularly during stressful conditions or situations. And then 4, you need to decrease your dosages of glucocorticoids and mineral corticoids during stressful situations. All right, so once again, let's look back at the question and what it's asking us. Regarding prevention of this complication being Addisonian crisis, how should the nurse inform the client? How should the nurse inform the client? 1, you can take either hydrocortisone. Oh my God, I'm about to yell again. I'm so sorry. 1, you can either take hydrocortisone or fludrocortisone for replacement. 2, you need to take your fludrocortisone 3 times a day to prevent a crisis. 3, you need to increase salt in your diet, particularly during stressful situations. Or 4, you need to decrease your dosages of glucocorticoids and mineralocorticoids during stressful situations. What is our answer? What is our answer? Oh. Okay, sorry. A lot of people saying, like, what is 1? What is 2? They're not yet. Sorry. I'm so sorry. I don't know what's going on. All right. So the answer is, what is 3? What is 3? You need to increase salt in your diet, particularly during stressful situations. All right. So who said what is 3 first? A lot of people said 1, 2, 4. Let's look and see. The answer, once again, is what is 3? You need to increase salt in your diet, particularly during stressful situations. Let's look and see who got what is 3. Oh my God. Ooh, sweet Jesus. My bad. What is 3? Patty B Cake. That's the first person I seen that got it. Let me see who else got it, if anyone else got it. Patty B Cake, that's all I see right now. I'm not gonna scroll through everything. Patty B Cake. You are on the scoreboard with 500 points. All right. You are now in the lead. Clap to you. All right. So you're on the scoreboard with 500 points. Right behind you is A1 Shebe with 400 points. Right behind you, Shay, is Benta Kid with 300 points. I'm sorry. And then right behind you, Benta Kid, is Everything Ari XO with 200 points. Those are our scores really quick. Real quick. So let's go ahead and get into who answered, who also answered first. Well, correctly. Ooh, so sorry. Don't do that to me. All right, so let's go ahead and get into the rationale. I didn't go over it. I was just trying to see who else got it. But honestly, Patty B Cake, I think was the only person that got it on my screen. All right, so this is the rationale. So remember, let's go back and figure out what the question's asking us and see what they actually gave us in the question. All right, so the nurses came for a client with Addison's disease. Addison's disease. All right. We're looking out for Addisonian crisis, all right? We're trying to prevent this complication from happening, but how should we inform the client to help them prevent Addisonian crisis? All right? It says Addison's disease is a result of adrenal cortical insufficiency. And management is focused on treating the underlying cause. Mama, you didn't miss the fun. I went to dinner and I had way too much fun. Yes. So management is focused on treating the underlying cause of that adrenal cortical insufficiency. Hormone therapy is used for replacement. Hydrocortisone has both glucocorticoid and mineralocorticoid properties and needs to be taken 3 times daily, with 2/3 of the daily dose taken on awakening. Okay. Fludrocortisone is taken once daily in the morning. And then salt additives are necessary, particularly during times of stress. Right? And it's to compensate for excess heat or humidity as a result of the condition. I think I saw Pat say something about, like, when you think about Addison's, think about adding salt. So the ADD in Addison's, add salt. Okay. Let me make sure that's what she said. Yep. Think Addison, add salt. Absolutely. That's exactly what I think of. That's what I use to help me through whenever I saw Addison's. I would think about Addison Montgomery from Grey's Anatomy, and then I would think about adding salt. Those just my brain would just be wired that way. I'm like, look at Addison, just, girl, don't you have surgery? And then add salt, Addison's. Okay. So great tip, Pat. It says there needs to be an increased dose of cortisol given for stressful situations such as surgery or hospitalization. All right, so once again, 3 is the correct answer. You need to increase salt in your diet, particularly during stressful situations. Girl, you better get that packet of salt and just get that salt and just when you're stressed. So right now, when you're studying for NCLEX, you want to get that salt and just Yoshi in this motherfucker, okay? All right. Great job, Patty, for 500 points. Let's go ahead and get into pediatrics. Let's do peds for... Oh my God. Please. Oh God. Please, Jesus. Sorry. I just keep yawning. Oh, okay, cool. Let's do pediatrics for 300. Peds for 300. All right. The nurse is collecting data on a child with a 1-week-old scratch. No, sorry, a 1-week-old cat scratch injury. While assessing the... It's so contagious. Did I make y'all yawn? My bad. The nurse is collecting data on a child with a 1-week-old cat scratch injury. While assessing the scratch, the nurse notes redness, heat, swelling, and red streaking surrounding the area. Okay, just real quick. When you see those words being described, when you see those words all together and it's describing something, what do you automatically think of? The red streaking around the area is really going to be the thing that kind of brings it home for you. So when you see something, when you see a scratch or some kind of abrasion, cut, whatever, and it has redness, yes. Heat, yes. Swelling, yes. But specifically a red streaking surrounding the area, it is an infection, but what specific type of infection do you want to think about? The red streaking surrounding the area is going to give it away. Yes, it's an infection because we have redness, heat, swelling, and all that great stuff. But when you see that red streaking around the area, a certain type of infection is supposed to instantly pop into your mind. What is it? Thank you, Isis Princess. Wait, it's Princess. Thank you. Thank you, the nurse, Tianda. Cellulitis, absolutely. Cellulitis. I just want to just ask y'all that real quick. Yes, cellulitis. All right. The child states that the scratch hurts. All right. So we got some pain with the redness, swelling, heat, and red streaking as well. All right. So all those things together is going to hint to cellulitis. All right. And in this question, cellulitis is diagnosed. All right. So when providing home care instructions, which statement by the mother indicates a need for further teaching? When providing home instructions for cellulitis, which statement by the mother, by my old lady, indicates a need for further teaching? 1, the child should rest in bed. 2, I will apply cold, moist soaks every 4 hours. 3, I should take the child's temperature and watch for a fever. Or 4, the affected extremity should be elevated and immobilized. What is our answer? What is our answer? All right. We got a 1-week-old cat scratch injury that's been diagnosed with as cellulitis. It's been diagnosed as cellulitis. So when you're providing home care instructions about said cellulitis from this cat scratch, what statement made by the patient's mother, indicates a need for further teaching? Y'all know what that means, right? Okay, we'll go into it. 1, the child should rest in bed. 2, I will apply cold, moist soaks every 4 hours. 3, I should take the child's temperature and watch for a fever. Or 4, the affected extremity should be elevated and immobilized. What's our answer? What statement made by this moms indicates a need for further teaching? All right. What is our answer? I'm saying like 2, 3, 4. I'm saying a little bit of everything. Let me scroll back up to see who first got it. All right, so the answer is, drum roll please. Hold on. What is 2? Sorry, I had a Cosmo. Stop. Don't make me laugh. What is 2? I will apply cool, moist soaks every 4 hours. That's going to indicate a need for further teaching. All right, the answer is what is 2. First person to get what is 2 on my screen, don't cuss me out. On my screen, it may be different on yours because of like lagging or anything like that, connectivity issues. Don't cuss me out. I can only go by what's on my screen. So the first person to get what is 2 is... Wait for it. Ooh, Shauna, you just had to say what is, baby girl. First person to get it was Katie K. First person to actually say what is, and then the answer to was Katie K. Everybody else, the other 2 before her, just said 2, but remember, this is Jeopardy style. Jeopardy style, you have to say what is. Now, on the NCLEX, you would have been fine. On the NCLEX, you would have been fine. It does not matter if you say what is. But like I said, we're playing for incentive. We're trying to make it fun. So just follow the rules, okay? But as long as you're getting the correct answers, you're fine. You're fine. So yes, what is 2 is the correct answer. Who did I say? Katie K. Wait, where'd you go? Katie K. There we go. Katie K. Onaya. Awesome. All right, so Katie K. You are on the scoreboard with 300 points. Awesome job. Katie K. Anya. All right, sure. Anya. Perfect. All right, so great job to you. Like I said, I'm always going to call out the people that got the answer correct, even if you weren't first, because I want to let you know that even though you weren't first, you on the right track, love. You are on the midnight train to pass the NCLEX. So, Shanna, awesome job. P. Wiley, Katie K, like I said, you're the first person to say what is. Radiant Butterfly, awesome job. Prajna Beauty, great job. Bella's mommy, it's Princess Simone, Datavia, NT Pink Rose, Immaculate Michelle, Black Pearls, her putting the child to bed. Nice part. She said crazy. All right, so let's go ahead and get into it. So remember, the question's asking which statement by the mother indicates a need for further teaching. Little tip, okay? Now, whenever you see which statement indicates a need for further teaching, you're looking for the statement that's wrong. All right. So if something needs further teaching, it means whatever they just said to you was just absolutely incorrect. It was absolutely incorrect. All right. They need further teaching because they don't have it yet. They don't get it. That's NCLEX's way of politely and respectively saying, did you listen to anything I just said? Let me say it again. That's the NCLEX way of saying you're not listening. Let me repeat myself because whatever you just told me was wrong. It was wrong, girl. So that is exactly what that means. So if something needs further teaching, it means it was in the first place you were wrong. You gave it to me. You did not give me factual information. So if someone comes to you and be like, LPNs are not nurses, you need further teaching and to consult Google. I don't know what's wrong with you. All right. So that's whenever you see that, that's a test taking strategy. Whenever you see that, just think, okay, I'm looking for the wrong answer. And sometimes that can be just a little bit challenging because you're so used to whenever you see a question, you're so used to being like, okay, let me get the correct answer. Because that's obviously the default. You're looking for the correct answer. But these little double negative questions where it's like asking you to find the incorrect answer, it can throw you off. Especially like when you read it, you be like, okay, I'm looking for the wrong answer. And then by the time you get to number 2, sometimes by the end of number 1, you're like, that's correct. Let me circle it. So you have to, with each one, I have to be like, okay, is this true or false? The child should rest in bed. Is that true or false? And with each question or with each answer choice, I'm asking myself that. So I don't kind of get beside myself and kind of get ahead of myself and just be like, okay, I'm looking for the right answer because it's default. All right, so that's kind of how I stay in tune with whatever the question's asking. But yeah, so yeah, once again, the answer is what is 2. This is the rationale, okay? Cellulitis is an infection of the dermis and the underlying hypodermis of the skin. The child with cellulitis should rest in bed, correct? And the affected extremity should be elevated and immobilized. Let me just stop right there. All right, it said the child with cellulitis should rest in bed and the affected extremity should be elevated and immobilized. Wasn't that one of our answer choices? Let's go back. All right, so remember, we're looking for the statement that indicates the need for further teaching. So we're looking for the incorrect statement. One says the child should rest in bed. This literally just said the child with cellulitis should rest in bed. So obviously that's going to be a correct statement. But remember, we're not looking for the correct statement. We're looking for the wrong statement. So 1's out. All right. And then number 4 says the affected extremity should be elevated and immobilized. And that's literally what it just said. Elevated and immobilized. So we know that 1 and 4 are actual correct statements. So once again, because we're not looking for correct statements, we know that that's not the answer. So 1 and 4 are out. And cross them out. They're out. Next thing, it says warm, moist soaks. Warm, moist soaks. All right, those are applied every 4 hours to increase circulation to the area, relieve pain, and promote healing. That's how petty NCLEX is. Okay, so it wasn't the moist soaks every 4 hours that got you. It was the fact that number 2 said I will apply cool moist soaks. And what you really should apply is warm moist soaks. Isn't that petty? Isn't that petty? So just to make you aware, just in case, maybe you'll see this again, whether it's in your like nursing school program, another practice test, whenever they're asking you for like whatever indicates further teaching or what's, you know, supposed to be true or factual, whatever, you want to pay attention to every word. All right. Like I said, this says apply cool moist soaks every 4 hours. In your mind, it's like, okay, yeah, every 4 hours. This should be, yep, that's what you should be doing. But it's really warm moist soaks every 4 hours. So you mean to tell me the cool versus warm is what's going to keep me between me and this pass? Absolutely not, ma'am. Absolutely not. No. All right, so just keep that in mind. Warm, moist soaks every 4 hours. That helps increase circulation to the infected area, relieve pain, and promote healing. Usually when you're applying like a cool moist soak or whatever, remember, cold helps to reduce edema and reduce swelling. So maybe if you had like a broken ankle or something, trying to recreate a step up dance sequence, you know, you broke your ankle or something like that and your ankle's now super swollen, that coldness is going to take down that that coldness is going to take down that swelling, but it is the warmth that's going to increase circulation. Just remember, you going into a nice warm bath, it's going to increase circulation throughout, not necessarily take down the swelling. Okay, so commit that to memory. All right, so that's why number 2 is correct, because it said cool when the answer was really moist. When the answer was really warm. Okay. It says frequent hand washing is essential to prevent the spread of infection, so obviously, and that the child should be carefully monitored for signs of sepsis, increased fever, chills, confusion, or for the spread of infection. All right. I wrote down who got that right. Okay, great. Correct. Cellulitis needs warm, moist soaks, and that's more so to help promote circulation. All right. So that was P's for 3, hundo. let's go ahead and get back into... Let's get back into mental health, but let's do this mental health for 500. Let's just go ahead and go there. Let's go there. All right, it says, a client with a potential for violence is exhibiting aggressive gestures, making belligerent comments to the other clients, and is continuously pacing in the hallway. All right, which comment by the nurse would be therapeutic at this time? Which comment by the nurse would be therapeutic at this time? Is it 1, what is causing you to behave so agitated? 2, why are you so... I'm sorry, but these are funny. Why are you intent on upsetting the other clients? 3, please stop so I don't have to put you in seclusion. 4, you're going to be restrained if you do not change your behavior. All right, we're looking for the comment by the nurse that would be therapeutic at this time. All right, remember, we have a client with the potential for violence who is exhibiting aggressive gestures. So maybe he like square up. Maybe he's like, you better give me some candy, because if you don't, I'm gonna beat your ass. You remember that TikTok? So those are some maybe aggressive gestures that this client is exhibiting. They're also making belligerent comments to the other clients. Maybe they're telling them to go fuck themselves. I don't know. But belligerent comments to the other clients, okay? And they're continuously pacing in the hallway. So what's the comment that's going to be made by you, future nurse, okay? Which comment made by the nurse would be therapeutic at this time? Number 1, what is causing you to behave so agitated? 2, why are you so intent on upsetting the other clients? Like, Miss Mary is over there crying because you just called her a bitch. Like, what are you doing? That's number 2. And then 3 says, please stop so I don't have to put you in seclusion. What is this, 60 days in? And then 4, you're going to be restrained. Sir, you're going to be restrained if you do not change your behavior. What would be therapeutic at this time? Okay. Therapeutic communication. This is super, super important, because when it comes to mental health, I'll explain it later. I'll honestly explain it later. Is Morgan still here? Help us, please. All right, so everyone's giving me 1. A lot of people are giving me 1. Okay, so the answer is, what is 1? What is 1? What is causing you to behave so agitated? The hell is wrong with you? I'm just kidding. Don't say that last part. But what is causing you to behave so agitated? All right, that's the appropriate response. Because you're trying to figure out what's causing this all of a sudden spurt of anger with this patient. All right, this helps make the client aware of the behavior. All right. What is causing you to behave so agitated? Maybe they didn't know they were behaving agitated, but by you saying what is causing you to behave this way, it helps them become aware of how they're acting, and it may assist the nurse in planning appropriate interventions. All right, asking why is confrontational and could further escalate the client's behavior. That's why I said what is causing you to behave so agitated, not like why are you being this way. That's not it. That is not it. And then it says the remaining options constitute threats to the client, which are inappropriate. You please stop, and if you don't, I'm gonna put you in seclusion. And then the other one was, you're going to be restrained if you don't stop. Those are threats made to the client. And I don't know about y'all, but if someone makes a threat to me, like, it makes me want to do things even more, because, you know, my mama. What you going to do? You're not going to tell me what I can do. So imagine a client with an actual, like, mental health, like disability, or just maybe mental health disorder, and you're sitting there telling, hey, look, if you don't stop, I'm gonna do this. It's most likely gonna make them do it more. It's most likely gonna make them do it. Mind you, that's me being a Scorpio, but for them, it's just inappropriate, A, and then B, it may honestly make the behavior worse. Okay, so once again, asking why is confrontational and could further escalate the client's behavior. Don't ask me why. All right, so that's why the answer is 1, which is what? Not why, but what is causing me to behave so agitated? Like, what's going on? All right, that's also going to get, like, asking questions and rephrasing it in a way so that they can answer the question and not really you say your opinion, state what it is. You asking that question is going to be therapeutic communication because it's allowing them to actually express and really say what it is on their mind, or what's really causing them to behave so agitated. It says with mental health patients, somebody said, Misha said, with mental health patients, you have to be very selective with what you say. Absolutely. You say the wrong thing and you're definitely going to add fuel to the fire. Definitely. So that's why, like, a lot of these questions when it comes to mental health, like, at first it can seem so, like, hard and it can seem so intimidating, but it's honestly just the way that you phrase questions and the way that you ask them. All right? Don't ask why. It's confrontational. Maybe replace the why with the what. And then maybe rephrase, if they say something to you, rephrase it and be like, I understand that you're upset. Can you tell me why you're upset? Or can you tell me what it is that's making you upset? You asking them that question and allowing them that opportunity to take control and be able to really express to you and tell you what their actual, like, point of view is, that's therapeutic communication for mental health patients. Does that make sense? All right, so the first person to get what is one is, hold on one second. Somebody said, what is causing you to behave so? Hold on one second. Scroll all the way up. Scroll. First person to get what is one is Prajna Beauty 360. Prajna _beauty. Beauty. I forgot how to spell 360. Congratulations. You're on the scoreboard and you have 500 points, which means you are tied with Patty BK for first place. All right, so we're going to have a little bit of a tiebreaker. We're going to do one more question. Okay? Who's on my other loves that got what is one, even though they weren't first? It's totally fine as long as you get it. That's all I care about. So yes, you got a first. NC Pink Rose, awesome job. Expect nothing less. Boy Schwartz and lip gloss, a mood. Shine Money, E-Love, C Monet, Bella's Mommy, I Am the Ambitious, Black Pearls, Misha Feel Good Fit, Immaculate Michelle, London Lauren, Mona Asia, Binta Kip, Pure Buyout. You never want to agitate the patients more to see escalate, but trying to understand them. Absolutely. Misha said her thing. All right, awesome job. Let's go ahead and get into our last question. It has to be a good one. I kind of want it to be pharmacology. One second. No, that one's easy. Hold on one second. Hold on one second. All right, let's do this one. Sure. All right. Okay, sure. Pharmacology for 300. This is our last question. Okay. A client has an as needed, or PRN, prescription for loperamide hydrochloride. Loperamide hydrochloride. For which condition should the nurse administer this medication? 1, constipation. 2, abdominal pain. 3, an episode of diarrhea. Or 4, hematest positive nasogastric tube drainage. What is our answer? A client has an as-needed prescription for loperamide hydrochloride. For which condition should the nurse administer this medication? 1, constipation. 2, abdominal pain. 3, an episode of diarrhea. Or 4, hematest positive nasogastric tube drainage. What is our answer? Quick little tip. NCLEX, on the NCLEX, whether it's RN, PN, Powerpuff Girls, whatever, on the NCLEX, you're only going to see, like, medication names, you're only going to see the generic medication names, all right? So don't go in there expecting to see brand name, because you won't. You won't. So just make sure when you're doing your pharmacology or drug cards or whatever, you're really paying attention to the generic and the brand name, all right? Generics for NCLEX, and honestly, the brand name is just for, like, real life situations, because when you actually get into the workforce, majority of people and patients are going to understand more if you're talking about the brand name. But as long as you know both, just in case, you'll be golden. All right, so what is our answer? What is our answer? Number 3. The answer is, what is 3? An episode of diarrhea. An episode of diarrhea. All right, loperamide hydrochloride. What is the brand name to loperamide hydrochloride? What is the what is the brand name for loperamide hydrochloride? I forgot. It's literally on the tip of my tongue. Okay, got it. Wait, no, I didn't. No, I got it. Thank you, Simone. Imodium. Absolutely. Absolutely. Loperamide hydrochloride is the generic name for brand name Imodium. All right, and that's our anti-diarrhea agent. That's our anti-diarrhea agent. So quick little tip, just in case you had no idea what that medication was. Just in case, you want to make sure you're paying attention to the question and the answer choices, because sometimes the answer choices will give you as many hints as possible. All right, so let's go back into this one. So quick little test taking strategy. All right, so number 1 was constipation. Number 2 was abdominal pain. Number 3 was an episode of diarrhea. We can honestly just stop there. So whenever you have a multiple choice question and you have an answer that's the opposite of another answer, i.e. constipation and diarrhea, more than likely it's going to be one of those. More than likely it's going to be one of those. Okay? If you have an answer that's either the opposite or just very similar or synonymous, it's going to be one of the other. So constipation and episode of diarrhea, that's automatically going to just make me think, okay, it's clearly between 1 and 3. It's clearly between 1 and 3. So then you can make your educated guess based off of that. But just kind of put that little test taking tip, strategy, whatever in your pocket, just in case you get another question that's maybe not this, but maybe it's asking you for signs and symptoms. And one answer is hypotension and another answer is hypertension. More than likely, it's going to be one of those two because they're opposite. So whenever you see opposite answers, more than likely it's going to be one of those answer choices. Okay? So Once again, the answer is number 3, an episode of diarrhea, which is the opposite of constipation, which is kind of how you can figure that out. But rationale says loperamide is an anti-diarrheal agent. It is used to manage acute and chronic diarrhea in conditions such as IBS, which is inflammatory bowel syndrome or disease. It says loperamide also can be used to reduce the volume of drainage from an ileostomy. Okay? It is not used for the conditions in options 1, 2, and 4. So constipation, abdominal pain, and a hematest positive NG tube drainage. Those are not situations where you would give loperamide, aka Imodium, or however you want to say it. Okay? Like I said, learn both. Learn both. The generic for the NCLEX, and then the brand name for real life afterwards, to be honest. All right, so the first person to get what is 3 on my screen, please don't cuss me out. Please don't cuss me out. Say no to alcohol, because I warned y'all that NCLEX Jeopardy would be lit. Like, I warned you. First person to get what is 3 on my screen was that NC Pink Rose. It sure is. NC Pink Rose. All right, what is 3? You just got 300 points added to, well, you're on the scoreboard with 300 points. Awesome job. Who else got it? Okay, so because we have 2 ties, we have Patty Bake and then Prene with 500 points. I want to see who's the first person between those 2 to answer this, and then that's going to be the person that wins. Let's look and see. All right, so great job, Shayna. Great job, K-Pile. I'm sorry. Great job, Sandra. Prajna Beauty. Awesome job. All right, so Prajna Beauty, you were the first person out of you and Patty Bake to answer this question correctly. So you are going to be our winner. You had 500 points, and so did Patty Bake, but this was our tiebreaker. I was going to see who answered correctly in first. And it was you. So Prene Beauty 360, congratulations. Great job. If you do not have the Ultimate Nursing School Bundle, that's our 400-page bestseller. It's our digital study kit that gives you everything from fundamentals all the way to mental health and maternity. You just want it for free. Yay! So just send me your first name, last name, and your email address, and I can go ahead and send that prize right over to you. Congratulations. Congratulations to all my loves that were on the scoreboard. And even if you were not on the scoreboard, as long as you was answering those questions correctly, you're the winner. Do you feel what I'm saying? Winner, winner, chicken dinner. Do you understand what I'm saying? Because on the NCLEX, it's not Jeopardy style, obviously. We're just playing this for fun, because y'all know I like to have fun. But as long as you were answering these questions, whether or not you were saying a what is style or just saying what the number was, you were still getting that content. You were still being able to accurately and correctly recall whatever answer that was and answer that question. So claps to everyone that came tonight and participated. Thank you so much. We do this every Thursday. Okay, we only went through about 1, 2, 3, 4, 5, 6. We went through about 7 questions. Every Thursday you have 25. Okay, so if you don't have the Nurse Sam app, it's literally a free app. It's literally called the Nurse Sam. I don't know how else to say it. It's the Nurse Sam. Search it in your Apple Store, your Google Play Store, or just click the link in my bio so you can go ahead and download the free Nurse Sam app so you can play the rest of the 25 questions. All right, like I said, we have 5 categories, 5 questions per category. We only played 7 of them. So to get your weekly practice in, and practice makes perfect, people be in my DMs all the time saying, oh my God, what can I do? What can I do to prepare for the NCLEX? What should I get? What should I do? Practice. I do it with you every Thursday. So just in case you don't know what to practice or how to practice, we just do it in a fun way on every Thursday at 7 p.m. Eastern Standard Time, right here on Instagram Live. I'm done with alcohol for the rest of the night, okay? But congratulations to everyone that came and participated. That means you are taking the actions and taking the steps to go ahead and pass this thing, whether it's NCLEX PN or RN. So snaps to you and congrats to you. Hold on. Let me scroll back. I want some rosé after watching it tonight. No, stay away from alcohol because I'm lit and on one, okay? I'm gonna go pass out. Congratulations. I realize you're giving money away. I want to get the bucks. Yes. I always say if you guys want to get like free bundles, there's literally no other way besides my giveaways than to come to NCLEX Jeopardy, Tease Tuesday, whatever. We give away free bundles. Like, I'm giving you the cheat codes. I'm giving the girls the cheat codes and the free bundles just because I want y'all to practice and I want y'all to succeed. Not everything's about a coin, okay? I literally do this because I want y'all to succeed and pass. Trust me, if I didn't, I would still be at the bar at Seasons 52. I promise. I had to get my dessert to go. Where's that? I had to get my dessert to go. Y'all see this key lime pie? Y'all see this love that I have for y'all? I said, sir, pack up my dessert because I have to go and see my loves in 20 minutes. I have 20 minutes to get home. Okay? I wouldn't do that if I didn't love y'all for real. I promise. I'd be 3 Cosmos in. 3 Cosmos in because I'm already 2 and a little lit. But it was super, super fun. Super, super fun. I love y'all so much. Right? I'm so dedicated. Thank you so much because I love y'all so much. I just want to make sure that y'all pass and y'all go ahead and get these nurse coins, whether it's an LPN coin, RN coin, travel nurse coin. I don't care. As long as y'all pass and do whatever y'all want to do, I just want to make sure I'm getting y'all to that next level. Okay? So Prene Beauty 360, please do not forget to DM me your first name, last name, and your email address so I can go ahead and send you this free digital 400-page bundle. Okay? Congratulations. Everybody else that wants to finish practicing what we just went over, like I said, we did 7 out of 25 questions. If you want to go ahead and get to the rest of the 18 other questions, I am going to be uploading. I'm literally doing it right now. I'm going to be uploading and updating the app. When you download the Nurse Sam app, open it up, you should see NCLEX Prep. Click NCLEX Prep. You should then see NCLEX Jeopardy Mobile. Tap here to play. Guess what you're going to do? Tap here to play. I'm sorry. I'm so sorry. Woo-wee. All right, let me go ahead and update y'all stuff. 1 second. All right, so I'm going to go and literally update it right now. I want y'all to see me update it so that after we get off live, y'all can go ahead and download the app. Or if you already have the app downloaded, just go straight to the app and be able to play this week's questions. All right, so replacing last week's questions with this week's questions, a fresh 25 set, a fresh set of 25 new questions. And then next Thursday, we're going to do it again. All right. If you guys do not have the Ultimate Nursing School bundle, you can, it is obviously still available. Click and spin the Wheel of Fortune or the Wheel of Discounts, I should say. And on my page, on the website, thenursesam.com, if it doesn't pop up for you, there's like a yellow gift box on the left side of the page. Click that. You can spin it, put your email address in it. You can win up to 40% off. Okay. I'm gonna just let you. quick little tip. If you spin the wheel of discounts and let's say you land on, I don't know, 20% off and it's nurse 20, what do you if it's nurse 20 for 20% off, what do you think 40% off? What do you think the code for 40% off is going to be? If 20% off is nurse 20, what do you think 40% off is going to be? Nurse 40. I just told you what the answer was. Nurse 40. So just in case you didn't get what you wanted to get, use code nurse 40 for 40% off. You did not hear that from me, and don't you dare repeat it. Use it, but don't repeat it. And don't put it, I'm not going to say what I'm going to say, but don't repeat it. All right, so let me go ahead and... All right, so the app is updated, so you should have the new questions from tonight. So you can go ahead and play the NCLEX Jeopardy mobile version. It's now been uploaded, and that's pretty much it. I have a wonderful surprise for you guys next week, starting on Monday. I think yes, Monday. So we have a wonderful giveaway coming up for you guys. Y'all know I like to do giveaways, so make sure y'all got everything you need. The Akia Brianna, you passed your T's. Congratulations, boo. Hold on, I'm gonna take a picture. I did it wrong. I hate myself. Okay, I screenshot it just then. Awesome job, the Akia Brianna. Congratulations. I am the ambitious one. I just passed my X exam now, waiting on the code to schedule for NCLEX. Awesome job. I'm so proud of y'all. All right, guys. So I just gave y'all the T and the codes. So I will see y'all next week, Thursday, for another round and another fresh set of 25 questions for NCLEX Jeopardy. Okay, if y'all have any questions, go ahead and email me at support@thenurse.sam. If you're not enrolled in the Study Bar membership, go ahead and do that. You can do that for $29.99 a month or $300 for the year. Okay, starting this Sunday, which is the 22nd, we're going to have a weekly kind of like tutoring sessions, like small tutoring sessions. And then this week, which is the 22nd, we'll be going over the endocrine system. All right, exclusive to my Study Bar members. So if you're not joined and enrolled, you need to do so, especially if you need some help on endocrine, okay? If you have any more questions, like I said, email me at support@thenurse.sam. Don't DM me because my DMs are atrocious. Email me. I promise I'll get to you faster, all right? Love you so much, and I'll see you next week.